Welcome to the Body Shop Physical Therapy. My name is Katherine Price and I'm a physical therapist. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. I'm going to do the Egoscue method for chronic hip pain. This is going to be an exercise menu that addresses the postural alignment and particularly related to the hip region and addressing chronic hip pain. So if you're having chronic hip pain, these exercises may be a benefit to you. Before I begin, I'm going to start with a word of life from 1 John 3:8. The one who does what is sinful is of the devil, because the devil has been sinning from the beginning. The reason the Son of God appeared was to destroy the devil's work. Amen. Follow along with me and I will take you through this exercise menu to address chronic hip pain. I'm going to be using a timer. I've got 2 blocks. I'm going to be using 1 block and you can use a pillow, so it's not absolutely necessary that you have a block. If you have an ottoman or something that's comfortable that you can kneel on that has some height, and then you can use a regular chair, or you can even use the ottoman if it is high enough, and I will show you that when we get to that. So those are the tools that I'm going to have. Let us begin. The first is going to be called the short foot. And the short foot, you just want to stand with your feet facing directly forward, hip width apart, and you are going to step 1 foot right in front of the other. So I've got my right foot in front of my left. My heel is going to be right in line with the toe of the back foot. I'm going to just slightly bend my knee, but keep my knees in line with my toes. And then I want to lift the toe on that right foot and the toes and spread them. And I'm going to keep the ball of the foot on the floor, and then I'm going to press down into the floor with the big toe with the toes, but not curl the toes, just pressing down and feel the arch lift. And I'm going to go back and forth, lift and press. 2, lift and press down. 3, lift and press down. 4, lift, press down. 5, lift, press down. 6, lift, press down. 7, lift, press down. 8, lift, press down. 9, lift, press down. 10. Bringing that foot back, stepping the other foot forward so that the heel is right in line with the toe, and lifting them, spreading those toes, and then pressing them down into the floor. Lift. 2, pressing down. 3, but not curling the toes, just pressing down so the arch is lifting. 4, lift and press. 5, lift, press down. 6, lift, press down. 7, lift, press down. 8, lift and spread, press down. 9, lift and spread, press down. 10. Alternating, other foot forward, right in line with the toes of the back foot. Lift those toes, spread the toes, and then press down. 1. We're going to do 3 sets of 10 each side. 2, lift, press down. 3, keep a straight, nice, tall posture. 4, lift, press. 5, lift, press. 6, lift, press down. 7, lift, press down. 8, lift, press. 9, lift, press down. 10. Alternating, left foot forward, knees are slightly bent, lifting and spread those toes. Press down. 1, lift and spread, press down. 2, lift and spread, press down. 3, lift and spread, press. 4, lift, press. 5, lift, press. 6, lift, press. 7, lift, press. 8, lift, press. 9, lift and press down. 10. Alternating, other foot forward, right foot's forward, lifting those toes, press down. 1, this is my last set. Press. 2, lift, press. 3, lift, press. 4, lift, press. 5, lift, press, 6, lift, press, 7, lift, press, 8, lift, press, 9, lift and spread those toes, press down, 10. Alternating. Last set on the left foot, lift and spread, press, 1, lift, 2, lift and spread, press, 3, lift and press, 4, lift and spread those toes, pressing down, 5, lift and press, 6, try not to curl the toes, press, 7, lift, not the easiest, press, 8, lift, press, 9, lift and spread those toes, keeping the ball of the foot down, and 10, and relax. Next is going to be hanging. So if I'm standing in front, I want my feet hip width apart, facing forward. I want to tighten my thighs, and then I'm just going to forward fold and hang. I don't want to stick my butt up. I just want to hang, and you want to hang for 1 minute. So I'm just allowing my head, neck to relax, and I'm keeping my thighs tight. From the side, I've got my feet facing forward, and I'm just folding forward and just tightening those thighs and holding this position or this posture. Now, if I cannot get down to the ground and it's straining, I can put some blocks to support my arms and then just hang there. But I want to try to keep my knees straight. So if you've got really tight hamstrings, you want to straighten those legs first and then only forward fold where you can. And then just hold this, hold this, hold this, keeping those thighs tight. So tightening the thighs and holding this position. Taking a breath in, all the way out, keeping the thighs tight. That's not easy, so you want to engage those thighs and focus on that. After this, we're going to do cats and dogs. That is 1 minute. So next is cats and dogs. I'm going to come onto my hands and my knees, my hands underneath my shoulders, and then my knees right underneath my hips. I'm going to round out my back, drop my head down, and then arch my back and look up for 1. You want to do this smoothly for a count of 10, 2, and then drop down, look up, and rounding out the back, 3, dropping down, look up, rounding, 4, and looking up, rounding, 5, looking up, 6, and I want to do this as smoothly as I can. Rounding, 7, looking up, 8, looking up, 9, looking up, and last one, rounding out the back, and then looking up. So that's cats and dogs. The next one is static back. And so I'm going to then, you can use a regular chair or an ottoman. I am going to use this ottoman, but I am going to add a pillow to it so that I can get my hips and knees in a 90-90 position. So I want to bring my legs up over the chair, over the ottoman. I'm going to lie on my back so that my buttocks is up close. You want your hips and your knees bent to 90 degrees. And then you want to bring your arms 45 degrees away from your body. I'm going to set the timer for 5 minutes. It's going to seem like a really long time. My hands and palms are going to be facing up towards the ceiling. And the hips and the knees are 90 degrees. I want my low back to sink down to the floor if I'm able. You don't need to force it. As you hang out here, it should just relax down towards the floor. I call this the astronaut position. It is wonderful for low back pain as well. It's going to decompress the back. It allows the hip flexors to shorten, and it gives natural traction so that the spine can stack and relax. So this is just a postural retraining, and you're just going to hang out here. I like to do diaphragmatic breathing as I'm holding this position, and so that is when you're going to breathe from the diaphragm. The diaphragm is a dome-shaped muscle that's at the very bottom of the rib cage, and so when you're using your diaphragm, you're going to be pulling the air in from the bottom of the rib cage. You want to feel the ribs press against the floor. So I'm going to inhale, feeling the back of the ribs pressing into the floor, the ribs cage expanding, and then exhale. Letting the breath fall out. So also paying attention to the shoulders. When you inhale, you don't want to be using the shoulders to come up towards the ears. You actually want to pull those shoulders down, but not arch your back as you're pulling the air in from the diaphragm. So my shoulders are going to stay down away from my ears, and I want to breathe in. Shoulders are going down, and then exhaling. Take a nice deep breath in. And then exhaling. Breathing in. Exhaling. Breathing in. Exhaling. See where we are in our time. We've got a couple more minutes left to go. Just continue to hang out, working on your diaphragmatic breathing. Palms are facing up towards the ceiling, 45 degrees away from your body. Relaxing your back down to the floor, breathing in all the way out. Almost one more minute. So that is 5 minutes of the static back. I'll come out of that, and I'm going to go right into the hook lying rocking chair. So for that, I'm going to lie onto my back with my knees bent. Feet are going to be facing forward. The block is going to go between my knees. You can use a pillow. Palms are going to be facing up 45 degrees away from my body. I'm going to then lift my toes and lift my feet with my heels staying contacted onto the mat, and then I want to lift my heels, keeping my big toe contacting into the mat as I lift there. And you just want to rock back and forth. So we're gonna start and we'll go through 3 sets of 10. So starting with pushing down, lifting the heels, and then lift the toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now I want to make sure too that I'm keeping pressure to hold that block. Another set, so take a deep breath. And going again, lifting the heels and then lift the toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. Pause, deep breath. Last set, lifting the heels, toe stay down, big toe stays contacted. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. Then I will take the block away, and this is going to, the next one is the unilateral supine femur rotation. So arms stay in same position, knees start and bent. I'm going to straighten out my right leg. I'm going to take that foot, pull it up, and then I'm going to rotate that foot in as far as I can using my hip, and then out, but keeping the thigh tight. So you want to tighten the thigh, keep that toe up, so dorsiflex, you're keeping the foot up. You want to keep the thigh tight and rotate in, originating the movement from the hip, and then rotate out. 1, rotating in. 2, rotate out. Rotate in. 3, rotate out. Rotate in. 4, out, rotate in. 5, rotate out, rotate in. 6, rotate out, rotate in. 7, rotate out, rotate in. 8, back out. 9, turn the foot out with this hip, and 10, and out. Then I'm going to switch legs, alternating. Left foot then goes out. Tighten that thigh, pull the foot up, rotate that leg in and then out. Here we go, starting with the rotation in. 1, and then out. 2, out to the side. 3, 4, keep the thigh tight. 5, move from the hip. 6, 7, 8, 9, 10. Bringing that leg up, straightening the other leg out. So this is going to be 2 sets of 10. Tighten the thigh, pull the foot up, and rotate back and forth, starting with the internal rotation. All right, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And alternating last set on this left side, pulling the foot up, tighten that thigh. Start with internal rotation and then rotate out to the side. So rotate 1, make sure the thigh is tight, 2, 3, 4, make sure the movement's coming from the hip, 5, 6, 7, 8, 9, last one, rotating in and then out. All right, so I'm gonna stay in this position, but I'm gonna scoot over just because now I want my arms to go out in a T position, so 90 degrees away from the body. So I want my arms to come up, and then I want to picture a clock on my belly, and I'm going to do a posterior pelvic tilt. So if 12 o'clock's up at the top, 6 o'clock's at the bottom, I'm going 12 o'clock, 6 o'clock. Arms are going to be out to the side, directly out to the side, and I want to alternate back and forth. So 12 o'clock, 1, posterior pelvic tilt, arch my back. 2, so I'm just going to rock back and forth. 3, 4, 5, 6, and I'm using my abdominals to tilt my hips backwards. 7, 8, tilting my hips forward. 9, tilt forward, and 10, and tilt forward. So those are my pelvic tilts. After the pelvic tilt, I'm going to do static extension, and that's where you're going to use the ottoman. So what I'm going to do, set my timer for 2 minutes, and I want you to come up onto something that is comfortable for you to kneel on, and I don't need to be this high, but I want to be off of the ground. So I'm going to kneel onto the ottoman and walk my hands out in front. I'm going to go ahead and set my timer because this is going to be for 2 minutes. I want my hands to be underneath my shoulders. Once I am in this position, I want to shift my hips 6 to 8 inches forward in front of my knees. Then I want to tilt my buttocks up towards the ceiling and drop my head. What you want to happen is you want your shoulder blades, you want them to sink close to your spine. You want to tilt your buttocks up towards the ceiling and allow a little arch in your back. And then you want to just relax and hold this position. And you're going to hold for 2 minutes. Now you may start with 1 minute just because this is a lot of stress on the arms and you want to build up that arm strength to hold you here for longer. So 1 minute is fine to start with, but then if you can, you want to build up to 2 minutes holding this posture. And again, I'm just shifting my hips about 6 to 8 inches in front of the knee, and then allowing my shoulder blades to come close to the spine. Relax my head and neck, and just hold here. And let's see where we are on the time. 12 seconds. So 10 seconds to go. 7, 6, 5, 4, 3, 2, 1. Okay. After the static extension, I'm going to go right back down into quadruped. and do cats and dogs again. So I'm going to round out my back and drop down and go through 10 more cats and dogs with smooth movement. 2, 3, 4, 5, 6, 7, dropping down, 8, dropping down, looking up, 9, dropping down, looking up, and 10, dropping down, looking up. The last exercise on this menu for the hips, pelvis with pain is going to be an air bench or wall sit. And so 1 to 3 minutes is the amount of time that you want to do this. So you want to find a wall. You want your toes facing forward. You want to position yourself so that your knee is bent to a 90-degree angle if possible. If you're having knee pain, you want to lift your body up until that pain dissipates or goes away. So you don't want to hold this position if you're having knee pain. Once you're here too, you want to make sure that your low back is against the wall and you want to hold this position. You should feel the thighs working, so the top of the leg should be working nicely. And you just get right into this position, back is against the wall, toes are facing directly forward, and then just hold this position. This is called an air bench. It is a wall sit. If you haven't done wall sits before, I would do 1 minute and then build up to the 3 minutes. So you want to get in place, hold yourself, and I'll tell you when we've gotten to 1 minute. You're almost there. 10 seconds. 9, 8, 7, 6, 5, 4, 2, 1. So that's at a minute. You can continue to hang out here and stay longer. Again, you want to build up to trying to do 3 minutes. So you're going to have some nice build in the leg strength doing this. And again, all these exercises are for the hips, the pelvis with pain. And so this is a menu of 10 exercises. You're doing great. 20 seconds, and that's going to be at 2 minutes. Can feel it really working on the legs. Less than a minute to go, so you've been here for 2 minutes. All right, 30 seconds to go, and that'll be 3 minutes. Ten seconds to go. So that completes the exercise menu for the hips, pelvis with pain, and it is a menu of 10 exercises. So if you're having chronic pelvic or hip pain, these may be of benefit to you. I hope this helps, and have a blessed day. Thank you.